Here's a troubling stat. New York ranks dead last in the country in providing early intervention services to babies and their parents. In the first months and years of life, specific therapies for infants developing slowly can make a huge difference, but long waiting lines have delayed that option for many families. And to add insult to injury, there's another problem now. A garbled software rollout that providers say the state should have seen coming. A special report on today's Story of the Day.
Support for Story of the Day comes from Clarkson University, offering over 95 programs of study with campuses in the Hudson Valley, Central, and Northern New York. More at clarkson.edu.
Hey, I'm David Sommerstein. It's Friday, December 20th. First up, an electric aerospace company based in Sweden plans to flight test its first fully electric experimental aircraft in Clinton County next year. Hart Aerospace wants to bring its 30-seat passenger plane to Plattsburgh International Airport. The company says the aircraft has a zero-emissions range of more than 120 miles and a hybrid range of almost 250 miles. Molly Ryan is the Economic Development Director for Clinton County, which owns the airport. She says she doesn't have any specifics yet on whether Hart plans to move any of its operations to the region or how many local jobs the company plans to create.
We have had conversations about them setting up some programs with our workforce development because we do know that they eventually will need jobs. We just don't have any definitive numbers.
Hart is currently testing its experimental aircraft to ensure a safe flight in Plattsburgh next year. Its planned arrival is early 2025. New York has been struggling to provide early intervention services to babies with developmental delays for years now. That's because of long wait lists and a severe shortage of therapists. Last week, we reported on a new challenge. It's been over 2 months now that many early intervention providers have been inconsistently paid because of new computer software released last fall. Today, we're digging deeper into how the messy rollout of a new state system is having devastating consequences for providers and families. Amy Feiereisel has more.
Financially, this fall has been really stressful for Lacey Schweigert.
I had no money. I didn't know if I was going to be able to even have a Thanksgiving meal with my children.
But Schweigert didn't have a medical crisis or get laid off from work. She's a special education instructor. And she has been working, providing therapy to babies with developmental delays in Albany and the Capital Region. She just hasn't been getting paid.
I'm not getting paid consistently, and I'm not getting fully paid. I haven't paid my rent this month because I only had enough for half of it.
Schweigert is one of thousands of early intervention providers who've been struggling since October 15th. That's when New York State launched a new software system to manage early intervention. But it's been slow, glitchy, and in some cases, non-functional.
And so this is all just lots and lots of extra time, and therapists are having to work late into the evening and weekends and not getting help or relief from it.
Rebecca Kelly is the early intervention manager for Lewis County. She says in the new software, tasks that used to take 15 minutes now take hours, and there's no way to get help.
I've had my own service coordinators with the county waiting 2 hours plus for a phone call. And then when someone answers, they're not even able to help you. So then they have to put in a ticket.
What's frustrating for Kelly is that the new software, EI Hub, has been in the works for 4 years. And in its testing, Kelly says providers told the state and the company that made it, called Public Consulting Group, or PCG, that the software didn't work.
And that's really unfortunate because we all could sort of see the writing on the wall with how this was going to play out, which then translates to down the road, a domino effect for our children and getting services in a world where we already have a significant number of kids on the wait list in the North Country.
I put in requests for comment to the offices of PCG, Governor Kathy Hochul, and the state's Bureau for Early Intervention. Just the last responded via a written statement. It said it was critical that the state move to new software because the old system from 2013 was vulnerable to security and safety concerns. At a meeting in Albany last week, PCG project manager Lauren Zielinski said the company has been making improvements to EI Hub since its launch.
And we're committed to keeping communication as transparent as possible with all stakeholders. And again, we look at you as partners when we hear your feedback.
But the problem and mounting frustration from providers is a lot bigger than just glitchy software. New York State ranks 50th, as in last, in the United States for fulfillment of early intervention services. For years now, there's been a shortage of therapists and long wait lists for nearly every county in the state.
It's a repeated pattern for New York State to treat providers poorly, and then we don't have providers.
Tracy Harris runs a therapy agency in Watertown in Jefferson County and has been working in early intervention for 3 decades. She says the biggest issue is pay. You see, early intervention providers work as independent contractors, and they're paid according to fixed rates set by New York. Those rates haven't changed since 1994.
Nowhere else in the state would workers work where they weren't getting incremental increases with costs of living and expenses.
Harris says early intervention therapists have been leaving the field for decades now, seeking private work or jobs in K-12 schools where they can expect raises, a pension, health care. She says that's why the launch of a non-functional billing system feels like such a slap in the face. It's why she started advocating and trying to organize with other providers.
And we really need to push the lawmakers and our governor to do something so that this program, which is so critical, I mean, again, it's the most vulnerable children that we have across the state, can be successful.
Andrew Cassini, a Rochester-based occupational therapist, is another provider-turned-advocate. He started a Facebook group for therapists to troubleshoot their issues with EI Hub.
But it's unreal that professionals need to go to a Facebook group to achieve help to do their jobs when PCG was awarded $53 million.
Cassini is referring to the state contract PCG was awarded in 2020. He and others are questioning why New York State hired PCG in the first place.
They have such a terrible record in other states that anybody could Google.
Here's a few cases. In 2017, PCG started providing early intervention software for the state of New Jersey, with very similar rollout problems and providers not getting paid. That same year, the company was sued for systematically denying overtime pay to Pennsylvania home care workers. In 2018, Mississippi's Department of Education abandoned a $5.5 million special education software contract with PCG. This is all public record, and Cassini says he doesn't understand why New York chose the company.
It's unfathomable that this history of PCG was unknown to the New York State Department of Health.
The state says PCG was selected after it was the, quote, sole vendor to submit a proposal, end quote. At the Albany meeting last week, PCG spokesperson Rob Lillipop asked for patience.
I ask, providers to stick with us. It's important.
But patience is wearing thin. A Change.org petition decrying the EI Hub rollout and asking for Governor Hochul to intervene has over 13,000 signatures. There's been no response. Several advocates I spoke with say they're calling on the U.S. Department of Education for a federal investigation into New York hiring PCG. Tracy Harris, the early intervention provider in Watertown, says while EI Hub is making therapists' lives a nightmare, it's children who will really pay the price.
It's not children with mild delays. It's children with severe disabilities and diagnoses, and they need their services. These strategies that we give them when they're really young can help them develop all the way through.
When babies and toddlers don't get that help, Harris says they go into school with much bigger issues that take a lot more work to address. Shortly after I spoke with the therapist in Albany, Lacey Schweigert, she was told the rest of her unpaid claims since October 15th would be pushed through. She said she was grateful, but it left her wondering, what about the claims she put in next week? Amy Feiereisel, North Country Public Radio.
We have more news all the time and through the weekend on our website, ncpr.org. Music today by Ben Cato of Jay and Danny Thomas of Canton. Have a great weekend. I'm David Summerstein, North Country Public Radio.